Join us for our presentation on cardiomyopathy, starring Nate, Tina, Annabelle, Heather, and Rhonda.
A 60-year-old female patient is being transported to the local emergency department. The patient is currently stable with no signs of distress.
Hey, my name is Nate. I'm the triage nurse here in the ER. What's going on today?
I'm really concerned. I've been experiencing weakness, fatigue, difficulty walking up the stairs, and feeling palpitations for the past week. I've also been feeling short of breath when I walk around the house too, and my shoes have been feeling really tight lately. I take a little pink pill every day for my high blood pressure, and I had to go to the local urgent care a couple weeks ago. It ended up being a bladder infection, they told me, and I was on antibiotics for a week because of that. I know my diet is not the best, but I don't think it has anything to do with why I'm feeling the way I am. I tend to have a glass of wine or two with dinner most nights, and I mostly eat out. If I do eat at home, I usually eat frozen meals or canned soups.
Well, Miss Heather, we're a little worried about you. Your blood pressure is elevated right now, and your pulse is reading a little lower than it should. We're going to need you to take you back to one of our ER beds to see what is going on. I want to prepare you for what is to come for the next couple hours. Our tech Juanito is going to have you change into a gown and hook you up to the monitor so we can monitor your vital signs. And he's going to do a quick EKG to determine if anything serious is going on with your heart at this moment. I don't know what tests will be ordered, as different providers order different tests for their patients, but I know blood tests will be ordered, and that will let us know if anything is going on with your heart right now. Be prepared to have some pictures taken of your heart and lungs. Our radiology team will come by and take you for those pictures. Your vital signs are concerning, so we want to make sure we don't miss anything with all these tests. I want to assure you that we will do everything we can to help you while you are in our care. You have a great nurse in Rana that will take care of you, and our doctor that is on today, Dr. Sitsui, does great work. If you have any questions or concerns, please let our staff know. We are here for you.
Here in the laboratory, patiently waiting on test results. 1 year later.
So the plan for Mrs. Roberts is that I'm going to admit her for the night so we can get some of the excess fluid off of her. I already put in the orders for IV Lasix and a Foley catheter, so don't worry about that. And now we're just waiting for a bed for her on the teleunit. Also, her results are back, and she definitely has hypertrophic cardiomyopathy. It's probably as a result of her long-term hypertension, but as you know, there's no way of knowing for sure. So her CT scan shows thickening of the interventricular septum, and her echo came back with an ejection fraction of 50%. Her EKG upon arrival showed her a sinus brady in the 50s, but she said she has been experiencing heart palpitations intermittently at home, which as of right now I can only suspect is AFib. So I'm thinking I'm going to put in for her to go home with a 24-hour Holter monitor. I weighed the pros and cons and decided that I don't want to do the exercise stress test on her right now while she's got all of that extra fluid on her. Other than that, her labs were unremarkable with the exception of her BNP, which was elevated. Oh, and also, I think I'm going to recommend a pacemaker for her as well, pending the results of the Holter monitor, of course. So what I'm going to do right now is go and talk to her about wanting to admit her, and from there, I'm going to explain to her about the cardiomyopathy that we've diagnosed her with, and that I believe her to be a good candidate for the pacemaker and all that jazz. Then I think from there, I'll let you cover the rest of the plan of care. So make sure you go over any medications and any questions or concerns that she has.
Hi, Mrs. Roberts. I wanted to come in and introduce myself. My name is Dr. Sitsui. So I've just reviewed your labs and diagnostic results, and I wanted to inform you that you have a disease called hypertrophic cardiomyopathy. And what this basically is a disease of your heart muscle that causes it to pump less effectively. This disease process is the culprit behind all of the signs and symptoms you've been experiencing lately, but thankfully it can be managed with medications and lifestyle changes you can implement. For now, I want to keep you just overnight to get the swelling in your legs down. So since you don't have any further questions for me, Nurse Rhonda here is going to go over your plan of care with you.
Hi there, Miss Roberts. I know you just got done speaking with your doctor. She was able to look at all of your results and did decide that we are going to go ahead and keep you for observation. I know she explained a little bit to you about your condition, but she wanted me to go over your treatment plan with you for while you were here. She has ordered some medications for you. I'm going to go ahead and begin your IV Lasix therapy right away. This will pull off some of the extra fluid that is built up around your heart. We are also going to have to place a Foley catheter so that we can monitor your urinary output for now. This is a really uncomfortable procedure, but once it's in place, it shouldn't continue to be a problem. We are currently waiting on a bed for you on the telemetry unit where they will be able to monitor your heart for any sudden changes. The doctor has also ordered some diagnostics for you for after you go home, such as a Holter heart monitor and stress test, but they will explain that to you upon discharge. So as the doctor has already explained, she also feels that you are a good candidate for a pacemaker. Do you have any questions or concerns related to this news?
Doctor, this is the worst possible scenario for me. I'm so anxious. What am I supposed to do? I've never had surgery before, let alone one that involves my heart. I play such an active role in my grandchildren's lives, and I'm worried that I won't be able to keep up with them. If I choose to get a pacemaker, I'm afraid that my family won't want to invite me out to gatherings and outings because they'll think it's just too much to handle for my heart.
Those are all very valid concerns. I think that you will be happy to know that once you have recovered from the surgery, that having a pacemaker shouldn't interfere much with your activities of daily living, including being around your family. But just to set your mind at ease, I can also refer you for a consult with a social worker to discuss all of your concerns. Hi, Nurse Annabelle. I just wanted to go over a few things that have happened with Miss Roberts since she's been here, because she's scheduled to go home on your shift. She's been here since yesterday for observation regarding a new diagnosis of hypertrophic cardiomyopathy. We were able to get a lot of fluid off her while she was here, but the doctor did put some fluid restrictions on her for when she's at home, and he wants to encourage her to get some sort of activity into her lifestyle. The next big thing for her is going to be getting her scheduled for a pacemaker. She did have some concerns about that, but was able to see a social worker during her stay and has since reported feeling better. If you could please review her dietary habits with her, that would be good, as she told the triage nurse that she has a careless diet of unhealthy food on a regular basis. And that's about that. So thanks so much, Annabelle.
Hi there, Miss Roberts. My name is Annabelle and I am the discharge nurse here at this facility. I'm here to provide you with some take-home info regarding your new diagnosis of hypertrophic cardiomyopathy. I will make sure to provide you with some pamphlets regarding all of the info we discuss so that you can look back on in case you forget. When asked about your diet, you let us know that you mostly eat out, and when you do eat at home, it's canned or frozen meals. These type of foods in particular contain a high concentration of salt and should be removed from your diet as much as possible. Excess salt can lead to fluid retention and cause an exacerbation of AFib. Also regarding fluid retention, your doctor has set a daily limit of how much fluid you can have in one day to prevent fluid overload. If you experience any signs of fluid overload, such as gaining 2 pounds a day or 5 pounds a week, it is very important that you call your healthcare provider right away. Besides your diet, it is also very important that you stay as active as you can. Simple activities are recommended, such as walking or gardening. Find an activity that you enjoy and make it a priority. Here I have your take-home documents and pamphlets for you to refer back to. Please let us know if you have any more questions.